So, Dr. Karan, how much do you charge for upper third molar extraction?
We charge from 4 to 6,000 rupees.
एक दांत निकालने का इतना पैसा?
So this is the reaction that we often get when we quote our prices for removing a third molar or any tooth for per se. So we'll show you in upcoming following 1 or 2 cases that एक दांत निकालने का इतना क्यों.
So, Dr. Karan, what do you really think कि क्या exactly और ये सारे bruises जो हुए हैं face के ऊपर ये किस चीज की वजह क्या reason की वजह से हुए?
So this case was shared to me by one of my colleagues since it was making rounds on the social media. Basically, in this case, while removing the tooth, the doctor has used a forceps which is used to extract, and that has caused injury to the patient's lip and adjacent areas, and that injury has now turned into what we call cellulitis after 4 to 5 days, which is a very serious complication and a very avoidable complication at that. In the second case that we are going to put up, this case had come to me for extraction of the upper third molar. Since the tooth ahead of it was a root canal treated tooth, we advise a patient for extraction. But what happened is that the patient found the charges the same way like we started the video कि एक दांत का इतना, and they went and got it done elsewhere. After that, after 1 or 2 years, they came to us for some another treatment. And as usual, we have a protocol of taking a full mouth X-ray. So when we took the X-ray, we saw that the tooth ahead of the tooth to be removed has also been removed. It has been extracted. So we asked the patient, what happened? Why did you have to extract that upper the tooth ahead of the wisdom tooth? And the patient was completely shocked. He never knew that that tooth had been removed. And this is the reason why एक दांत निकालने का इतना.
जैसे हम लोग इस वीडियो को स्टार्ट करने से पहले डिस्कस कर रहे थे कि ये जो भी एक्सट्रैक्शन है उसके पहले करने के पहले भी या इवन जो भी प्रोसीजर हम लोग करते हैं उसके पहले देयर इज ऑलवेज अ प्री प्लानिंग.
Yes.
एवरी टूथ is being removed in a different थोड़ा fashion.
Each tooth has different anatomy. Each tooth has a different bone surrounding it, and so the technique for removing each and every tooth is different. You cannot apply one rule policy for removing all teeth. That's why in our clinic we have different charges for different teeth depending on the difficulty it takes to remove the tooth. But all this, like Dr. Kunal said, has to be pre-planned. So when a patient comes to us, first thing we do is we take an X-ray, we see the number of roots present, we see the quality of the bone around the tooth, whether the tooth is a root canal treated tooth or a normal tooth. Root canal treated teeth are often more complex to extract because they break more easily than a normal natural tooth which is not treated. So then the protocol completely changes for removing that particular tooth. Thirdly, we have to preserve the bone around the tooth in case it requires some replacement in the future. So that is very important. One more very important and crucial factor is the amount of proximity to the vital structures that are there. Some teeth are very close to the nerves and close to the sinus. So there you have to be very cautious while removing because you can injure that nerve and cause permanent damage for the patient in the lips and the tongue. And also you can push the tooth into the sinus, and then it becomes a simple extraction becomes a very complex extraction. So what could have been otherwise finished very easily and traumatically for the patient becomes a very traumatic process just because there is no planning before initiating the extraction, and secondly lack of experience with respect to proper extraction techniques. So it's very important for people to understand that why people say like एक दांत सिर्फ दांत निकालने का इतना सिर्फ दांत निकालना है. दांत निकालना एक प्रोसेस है. It's a procedure. It is not easy, and everybody, like you said, like we will be showing in multiple examples, it is not as simple as it looks. कि ऐसा उखाड़ लो पकड़ के खींच लो ऐसा नहीं होता है. There is a proper technique to be followed. and that is the reason why extraction becomes a complex procedure which was otherwise very simple. Just like in this case where the patient ended up with cellulitis for no reason whatsoever, just because of some inexperience or lack of attention to details and lack of planning, I feel.
Yes.
Now, 2 weeks ago, I removed Dr. Kunal's same tooth, which has been extracted in this case, and he is well and fine and doing good in front of you. So, yes, it is very important for the person to plan the treatment properly.
Yes.
To observe the anatomy properly and then remove the tooth. If Kunal, you want to add anything, you can add.
So, I have a question. So basically कभी कभी पेशेंट्स कंफ्यूज हो जाते हैं कि लोअर थर्ड मोलर को एक्सट्रैक्ट करना कभी कभी स्लाइटली ऑन द कॉस्टलियर साइड चला जाता है rather than removing some other teeth.
Correct.
Like, तो उस टाइम पे how can we, like, through this video, how can we just tell our patients?
So lower third molars are present first of all at a very precarious position in the jaw. They are very close to the what is known as the angle of the mandible. We'll show in pictures. So the jaw comes like this and it tilts over here, which is an angle. The bone becomes comparatively thinner in this region. So lower third molars are very, very, very close to that region. Plus, it is very, very close to the nerve which supplies the lip and the tongue. So what happens is, plus the bone in that region is very dense. Comparatively, in the front areas, the bone is softer than what it is in the back. As you go back, because maximum pressure is on that tooth, the bone is very dense. So sometimes a tooth which looks very simple to extract on a on an X-ray can be very difficult to extract in the mouth because of the way the roots are placed. The way the bone is bone pattern is there. So you can have very dense bone. You can have curved roots. There are varied anatomies in that area. That is why that becomes a surgical type of extraction in 90% of the cases. So you have to relieve the bone so that you don't apply undue pressure on the jaw. And you don't end up breaking the jaw of the patient while removing the tooth. We don't apply any pressure in that area. We have a different technique only of removing this teeth. We use different set of instruments only so that there is no nerve damage, so that we don't remove excessive bone. So that all comes with a cost and with experience. To be very simple. So basically, it makes the procedure costlier, but it will give you peace of mind in the long run, based on the number of complications we see on a daily basis. Because lifetime numbness lost. Numbness caused, sensation lost in that particular area is a permanent disability. Your speech is impaired, you will have saliva drooling out in public and you will not realize because there is no sensation here. All your spit and saliva comes out, people don't realize, and it is a very big public embarrassment also. There are many actors who have undergone this. I have had a few cases where actors have had damage in their tongue and they can't speak properly anymore. Just because a simple procedure is botched up. So that is very important to understand that just सिर्फ दांत निकालना नहीं होता है. There is a lot of attention to be paid. कौन सा दांत निकाल रहे हो, कहाँ का दांत निकाल रहे हो, क्या एनाटॉमी है, ये सब बहुत important है. हाँ, बहुत लोगों का निकल जाता है, बहुत इसमें हो जाता है, वो that is luck. So if you want to take luck out of the equation, then you need to do proper planning, like Dr. Kunal said. So we do proper mapping. For example, we'll show you that how we plan a third molar extraction or a lower third molar extraction before the patient comes. So we already have a rescue plan in mind before we start the procedure. We already know where we have to take our cuts before we start the procedure. So when we go into the procedure, our mind is already planned with that. This is how we are going to remove this tooth. It is not that the patient walks in, sits, and we just remove. So rarely it happens in cases. But majority cases, they are not in the proper position. They are either sleeping, horizontal, inverted, and otherwise going towards your cheek. So we'll show you the various positions also in which they are there. And then planning becomes a very key factor in getting a successful outcome.
That's correct.
Anything else?
No, nothing. I guess we have completed.
So like, share and subscribe, and we'll be back with more videos. Thank you.
For